I'm kind of a Johnny-come-lately to this field. Dr. Rohrich helped initiate a bunch of research that helped us understand some new anatomy of the face that was missed for at least 500 years, which is fascinating because it just tells you that our science is continuing to evolve. But it's Dr. Kenkel, Dr. Rohrich, Dr. Brown have done research on fillers for years, the fillers, injectables, and things like that. And it's often kind of downplayed in the press how important it is. But it's so fascinating. People in general are under the impression that all fat is bad. And I think it's a myth that the less fat we have, the better off we are. And that's an enormous myth. UT Southwestern is probably either the first or second most famous university in the United States for fat research. In our department, Dr. Rohrich and Dr. Brown are interfacing with the metabolic unit and their researchers who are truly world famous to look at how fat behaves. And what we're finding out, just fascinating things about fat. There are some children that are born with no fat, and they die of strokes by the age of 12. And the reason they die is because they have no place to put their fat that they eat or triglycerides. They die of strokes and heart attacks by the age of 12 or 13. And they age prematurely, too. Women with heavy butts, heavy hips, tend to be very, very healthy. They have a... and I tell my wife that all the time. No, actually, I'm not married. But anyway. But
you wouldn't have a good ride home, Joel.
Yeah, I know. But if you look at people, the pear shape, they have a place to put their fat to store it. So that fat doesn't go to the heart, it doesn't go to the liver, it doesn't go to your blood vessels in your neck, your heart vessels. So all fat is not bad. We need some place to put fat. There are some places that are bad to place fat. If you look at men that have visceral fat around their intestines, around the kidneys, inside the belly, that's bad fat. That carries a risk of heart disease. There are places on the face that we suspect are bad places to carry fat. So when we look at another face, we can actually tell if that person, we think we can, if they're at increased risk for heart disease, just by the way you look. And I'll leave you with just one point. When you go to see a plastic surgeon, you may walk in there and say, well, I want liposuction here, I want this lifted, this tucked, and this removed. But can you fill up my lips or put some fat in here or give me better cheeks? And that's the fascinating thing about adipose tissue, because we lose it in some places, we gain it in other places. And really aging, a lot about youthfulness is where we place fat, where we deposit it. So we could talk for weeks and weeks and weeks about this subject. It's one of my true loves of facial aging right now. But anyway, thank you.